And let me share. Oops.
Since we're a small enough group, do you want to do like real human introductions instead of
Yeah.
chat room introductions, Jamiah? What do you think?
Yeah, sure. We can do a little check-in. I love a good check-in. Yeah, if you guys want to share, Phoebe, you want to
Sure.
give a little bit about yourself, and then
I'll
you
pass
want
it
me?
to I'll
Yeah,
pass it to Valerie. Okay.
sure.
Hi, I'm Phoebe Walker. I'm the Director of Community Health at the Franklin Regional Council of Governments, which is the regional planning agency for Franklin County. And we are the host of the Franklin County North Quabbin CHIP, um, and which is just entering its third CHIP cycle. So we have a brand spanking new about to be published 2024 to 2028 health improvement plan that we are working on. And um, yeah, and I live in lovely rural Shelburne Falls and use
Oh,
she, her pronouns. I'm gonna pass it to you, Valerie.
okay. Um, I am Valerie Bean. I'm the Director of Development at Family Nurturing Center of Massachusetts, and we we have a chip project where we are. I always refer back to my um, the poster board that we made for our last event. It's very helpful. We do early childhood family engagement as part of the work that Family Nurturing Center does, and we do it in several communities and ourselves directly and oversee that in other neighborhoods in Boston. And our project is making sure that our what we call our family support networks, our early childhood family engagement networks, are meeting the needs of all of our uh, clientele, no matter their background or language. And part of what we're so we've been able to hire a director over all of our family support networks, and we've been able to do focus groups and surveys with parents and providers as part of this project, and also as part of our organizational strategic plan. And it is part of our strategic plan and part of this project to make sure that we are providing services and providing materials and follow up and getting feedback in multiple languages and recognizing the cultural diversity of all of the families engaged in our programs. And then working on having something that we can share out among the agencies that we work with and beyond that about that work. So yes, I live in Stoughton, Massachusetts, and our Family Nurturing Center's headquarters is in Dorchester. Let's see. I gotta put my glasses on and I'll pass it over to Robin.
Hello, I am Robin Toof. I work at UMass Lowell at the Center for Community Research and Engagement, and I am working with the City of Lawrence with the Lawrence CHIP. And we've been working on some materials that are really kind of organizational and resident friendly and helping to collect data that we feel are gaps in the health assessment data in order to create a better chip. So we've been piloting those materials and trying to gather actually it's awesome. I should have brought some pictures of these great posters there. We're also collecting data using these posters too, with all sorts of events that happen in the city of Lawrence over the summer. So, with dots and Post-its and whatnot, and they're so super colorful and people engage in conversations about what they're putting on the posters at these events and things too. But anyway, that's what we've been doing lately and we'll continue to do. I'll pass it over to Christine.
Morning. I was just typing Jamiah to say I think I'm in the wrong room, but I'm Christine Tangishaka. I'm the community wellness planner for Randolph under our community wellness project. And what was I else I was supposed to be saying? I think this to talk our healthcare in rural communities. So I mistook it for the roadmap talk that's coming up, I think, next week. But we are right now doing the executing a community outreach plan because we are in our 5th year of the grant and getting ready to send our letter of intent in November. So checking with our residents and community on what they imagine, what they say are the current priorities around health and wellness for Randolph. We don't want to presume based on, the last iteration. And so that's what I've been doing. Doing some coffee talks, meeting individually with people, meeting with small groups. And that's what we'll do now through early October.
You're not necessarily in the wrong place because it's not about rural healthcare. It's about how CHIP projects can connect to healthcare of all different in all different ways. How to build partnerships with healthcare.
Yes, and I hope you will stay because we do have a lunch and learn next Thursday as well, which I think you're thinking about for strategic planning. And come to that one too, which is not specific for CHIP. So this one's specific for CHIP. And we can also answer other questions about, general questions as well. And I don't know who El Ortega. I'm not sure who El Ortega is, but
Hi, my apologies. We do not have a camera yet. I am brand new I was just hired a month ago in the city of Lawrence. I am the community health specialist. I work with Robin in the CHIP program and Alicia Miller. We do run the program from the city of Lawrence here in the Mayor Health Task Force. As Robin mentioned, we have been collecting data for the CHIP program with different very colorful posters in the different community events in the city. We did have gathered a lot of information that we've been, sharing. And I also did, we are trying to engage different community groups so that we can do the community handbook so people can provide more information that we can share. And I already have 2 of the community groups that are already connected with us and they are willing to work with the handbook within their agency. I'm just waiting for one more to confirm. And then we're going to meet with them so that we can help them understand what is the CHIP community handbook is and how important it is for us to do the assessment in those communities with the people. So that's what we've been working on. But we've been gathering a lot of information for this now.
and I'm sorry, I didn't catch your name.
Lorenza.
Lorenza.
Yes. Ortega.
And you're in Lawrence. Okay. I was
Yes.
like, I think I heard Lawrence, but
Yes.
okay, Lorenza. Okay. Well, welcome.
Thank you.
Lawrence has been waiting a long time for you, so
Right.
this is exciting that
Yes.
they've hired this person. So congrats
Yes. Thank
and
you.
welcome.
Thank
And I'm Jamiah and I serve as a program officer for the CHIP. I use she, they pronouns, and we'll get to know each other as your project continues.
Thank you. I appreciate it. I'm looking forward to working with this wonderful group. It's a very good team. So I'm excited about the program too. So
Great. Thank you so much.
you're welcome.
Chelsea, we're just saying general introductions and about your CHIP.
Hi, I'm so sorry I'm late. I was like in another meeting and stuck in horrendous traffic, and I'm at a car appointment. I'm a little bit of a mess today. I am Chelsea Petrus. I'm the Executive Director of the Health Equity Partnership for North Central Mass, which is the Chenal number 9. So we're the Community Health Network area for our region, and we are in year 5 of our CHIP. Of our CHIP grant, I should say. We're actually we're on 8 years of having a CHIP.
Thank you, Chelsea. Juliet.
Hi everyone, Juliet Najumba from Africano Waltham. Sorry I was late too. We are in CHIP we're going to number 3, I think. Yeah.
First chip, third year of the chip.
Okay, first chip and then third year of the chip.
Yeah,
Yeah.
yeah,
And nice
yeah.
to meet everyone here.
Hi, Derek. We're just doing some introductions.
Oh, my name is Derek Neal. I'm the Chief Public Health Officer uh, for the city of Cambridge. And I believe we're going into our 4th year with our chip.
Thank you, everyone. So, yeah, we can get started. We also just wanted to kind of recognize that we are doing uh, focusing on how we build partnerships with healthcare in rural and urban communities, and recognize that recently there's been a lot of challenges in relation to Steward, and particularly the fact that Kearney is going to be closing. And I know, like Valerie, that's in the community that you serve in Dorchester, and recognizing the impact that that has on communities, but also realizing that there are a lot of different ways that we can engage with healthcare, and still thought it was important to have this conversation. And I don't know if you wanted to add any other thoughts, Phoebe, into sort of the current fiscal, I guess.
Right. I think only that it's clearly some of what we're suggesting may not be possible where you are right now because we're in a pretty rough time in healthcare, but we still thought that it would be worth having just sort of sharing some ideas for folks, and we've got great people in the room, so do chime in about how these community health improvement plan processes can integrate with healthcare in different ways and collaborate. So we've made some slides, and we're gonna go through them, but I think we're totally up for people being interrupted and chatted and things like that.
Yeah, and
Yeah.
thank you, Chelsea, for adding that as well. All right, sharing screen. Share. And are you guys seeing?
Yep, we're seeing the right version.
Okay, cool. All right. So the main topics we're going to be covering today include how healthcare and the chip connect with each other. So really laying the foundation about how they interact with one another. We'll talk about how you might want to identify the right healthcare partners that align with your values as well. And then we'll go through a variety of different collaboration opportunities that go from like very like strategic collaborations, relationship building collaborations, provide some really great examples of how you might work to build those relationships. And hopefully you can also share some ways that you've connected with healthcare. And then we'll talk more specifically about the CHIP process and opportunities throughout the cycle of engaging with healthcare. And then we'll end with some quick strategies for how you can communicate, initiate those interactions, and maintain them. Sound good? All
All
right.
right. Well, we wanted to start off with everyone's favorite circle, the CHIP process, that presumably, if you're at this workshop, you're familiar with. But this is basically the cycle that this is this is the Association for Community Health's particular model of the cycle that we are all involved in terms of doing the work to both engage the community, identify problems, identify strategies to address them, implement them, evaluate that, and then start it all over again in 3 to 5 years. And that tends to also include a community health needs assessment, and that can be one of the one of the ways, obviously, that it's easiest to relate to healthcare in. But all of us have the chip. The chip that I have is a 30-town region that has been going since about 2016 and involves healthcare in a bunch of different ways, and that has sort of waxed and waned over the years. And I imagine that for the rest of you, that is true as well. But we just wanted to start with like a grounding of the fact that because community health improvement plans are built off of community health needs assessments, this is the sort of core initial collaboration that people tend to see.
Yeah, and I'll just also add that my experience with CHIPs are in the Boston area. And I think what's unique, or not unique about Boston, but the way that the CHIP in Boston has kind of coalesced over the last decade, I would say, is to have all of the hospitals come together to have to collect data and create a community, a Boston CHIP. Where each hospital can sort of target different neighborhoods and different communities. They can also have their own plans, but it's a really great way to collaborate, seeing as how we are fortunate to have many hospitals in the region, but also they often have overlapping audience populations and patients. And so it's a great way for to get health to sort of frame it as how healthcare institutions can work together around a chip. So I sort of bring that lens into this, and particularly when you're doing the needs assessment, um, it really helps to streamline the data collection process when you can collaborate in that way.
And we do that as well in a much larger area of all of Western Mass. The hospitals all collaborate on community health needs assessments. Our CHIPs are at a more sub-regional level. Because obviously Boston is one place, but if you have got 4 counties, the CHIPs out here tend to be more sub-regional. All right. So in this presentation, we're talking about the dark blue forms of healthcare, but we didn't want to presume that that's the only kind of healthcare. And we, as Jamiah and I were planning this together, we were talking about, well, there could be future conversations about pretty much all of the ones in gray here, the ones we're not really talking about today, around working as CHIPs with local public health departments, with community health workers, with behavioral health. But for now, since we only have a little while during these office hours, we figured we'd focus on sort of the classic primary care related stuff. I think we can go to the next slide.
So we listed like a few different kinds of partnerships and just thought it was really important to think about this when you engage, to think about how you engage with these different healthcare institutions. And I think what's great about, which we'll get into a little bit more, is that in Massachusetts, we really do from the state support a health equity lens. So I think there's in partnerships, I think there's an opportunity to definitely connect with a lot of our healthcare institutions. And so it's important that you really make sure that those values and mission are aligned. And usually in their mission statements, they voice their commitment to health equity and to improving their population health. So it's really important that framing to think about, okay, if their population, if we're in their population and they're committed to this, that maybe there's opportunity for us to partner around that. I think it's important that they are working to build trust in communities and undo harm so that those relationships can be mutually beneficial. Understanding how their advisory boards are structured, this is public information, so you can find out who's on their advisory board and what is their sort of for different institutions, it looks different, but how many community partners do they have? And sort of what is the balance between those with lots of structural power and those with lived experience in those communities. Oftentimes, you can see how they are investing in community and working with community. So are they collaborating? Are they doing co-designing community initiatives? Do they invest different resources or like sponsorships into community? And it's a really great way to like try to do your research and see where there might be opportunity and if the sort of options that they provide align with what you're looking for as well. And particularly if they do engage with communities often and in a variety of ways, that's an opportunity to work to build long-term relationships. And as I mentioned, we'll go through different ways you can partner with healthcare institutions. But oftentimes you do start with um, with sponsorships or volunteer activities and can move into more of the co-designing spaces and collaboration. So it's a really great way to think about if these opportunities exist, and that is a good opening for you to begin relationship building. And I think a really important factor is if they have staff dedicated to outreach and engagement. Do they have like what is their community health workers? Do they have an outreach or communications department that really does try to engage directly with community? Because that I think that says that they have an institutional commitment and actually have folks dedicated to building relationships, to being a liaison. And those titles might look different in different institutions, but in that role, if they are responsible for building partnerships, learning about the communities that they serve, then that really aligns with the goals of a chip, but also what I think makes a really good long-term partner.
And I just wanted to say here that that would be my dream hospital, and in the poorly funded, tiny, struggling little community hospital world, it would be amazing if there was somebody whose job was outreach and engagement. So sometimes you have to sort of storm the castle, and sometimes there is somebody whose job it is to engage with you. Um, um, so
Phoebe, I was going to say the same thing. I find that partly it's a matter of just not having the staff, right? And partly there's a little bit of a like in our regions anyway, those people end up wearing multiple hats, and usually they are under some kind of like marketing, public relations kind of arm, where their primary job is to make the hospital look good. Their primary job is not necessarily to authentically embed themselves and engage with community and then bring that back to the hospital. So our role, like as an outside, like that's what that partnership, like what Phoebe does and what we do, like how that partnership ends up being so important is that you're not just coming out like once every 3 years to do a community health assessment and be like, now we actually want to hear from you. Like
Right.
you're doing that work constantly.
Yes. Yeah, for
Thank
sure.
you.
Yeah, and to that point, like you're not going to check everything off the box when you're trying to reach, but I think you definitely have to be committed to a shared goal and a vision of the community, because I think that makes it, particularly if you're from a marginalized community, makes it particularly difficult. And I think the relationship building looks very different in that space than it does with an organization that is more committed and practices
Mhm.
so that has similar practices to you. All right, next slide. Is this me? Okay. Okay, so now we're going to talk a little bit more about those decision-making spaces. So in the previous slide, I mentioned advisory boards. And so we're going to dig into a little bit of what that looks like in different sectors and sort of, we'll share these slides, so you'll get these links. But every hospital has to have a patient family advisory council. And this has been around for about since 2009. And the purpose of this is to really for their actual patient population to participate in the decision-making, information sharing, and policy and program development. And so this is a really great place if you are a patient of that institution to be able to engage with them. And also a good way to like reach out and uh, connect with folks in the community.
Yes, especially because this is one of those structurally required advisory councils that gives you that has some weight and often meets with upper leadership. I just put the link to the state rule about what they need to be and what their mission is in the chat if people want. And the next group is the Community Benefits Advisory Councils. I've been the co-chair of mine with the president of our local community hospital for the last 10 years or so. And this is also one of those, sort of mandated by, in this case, the Attorney General's office, that there be community input into nonprofit hospitals. And groups create this space really differently from hospital to hospital, but I have found it to be an amazing place to have the things that the hospital is calling a community benefit. So they have to every year submit a report, 2 different reports, one to the IRS and one to the Attorney General's office to prove what they're doing for community benefits. And each one of them has a different definition of community benefit. But that needs to be reviewed and approved by the Community Benefits Advisory Council. So it's this wonderful opportunity to be like, what are you calling a community benefit? And is it benefiting the community? And I mean, this makes it sound a little bit aggressive. It isn't. We've had a great working relationship, but it is important, I think, for things that are being considered a community benefit to come before the community and have some conversations. And sometimes that's just somebody who runs a particular program at the hospital coming and giving a presentation to us, and us being, different organizations and people who are there, people with lived experience saying, well, are you connecting to this community? Do you offer this? So we're sort of a place where those benefits can bounce off people there and get input. And then it's also the place that in a hospital oversees the community health needs assessment process. So again, it is the organization, the council that defines the population, defines the priorities. And even if there are much larger regional processes like the one both Jamiah and I were talking about, there is a Community Benefits Advisory Council that needs to kind of sign off on stuff and give input into it and be engaged in that regional one. So that's, I think, a great place to join, and often not particularly hard to get on.
Can I just also add something, if that's okay?
Of course.
I think I'll just add, like, at least for Massachusetts, what I think is particularly helpful is that because the CBAC and the allocations committees, in some places they're separate, but the Department of Public Health regulations are a little bit more strict. So it makes sense to sort of meet the needs of DPH's regulations within your CBAC. And so I think that connection is the DON money is what funds this project, right? Across the state, and it's then redistributed more equitably. And so with that regulation sort of in working together with the Attorney General's guidelines and the federal guidelines, I think it really creates an opportunity to have more input in an equitable way in the CHIP processes in the state. So just kind of wanted to kind of add that little piece there, because in other parts of the country, I feel like that when they have DON regulations, they might call it something different. They don't necessarily align as closely with what the federal regulations are.
Right. Agreed. Yeah. And then finally here, in terms of another kind of advisory group, a much more intense opportunity is to be on the board of directors of a federally qualified health center. All of us on this call, I'm sure, have an FQHC somewhere near us. And that board needs to be 50% patient served. So that does mean that 49% of the people don't need to be patient served by that health center. And this is, again, I'm sure I'm telling you things you already know, but I mean, it's pretty powerful, right? To actually have the people being served by a medical practice run the medical practice. And there are also seats on those boards often for people with other forms of expertise. So
Sorry.
highly recommend. That's okay. This has also been it's been an extremely worthwhile thing for me that I've been involved in for years also, as being on the board of our federally qualified community health center. And they also have to do an every 3-year community health needs assessment. And if they're at the same in the same geography, to Chelsea's earlier point in the chat, you know, that's an opportunity for the same health assessment to meet 2 requirements or more. So a great place to link up to if there's room, if you're served by that, if you have interest in it. Okay.
This is me. Wait, why can't I
What?
see
This
them?
is me.
This is you. Okay.
Okay, this is me. Great. So one thing we just wanted to highlight, and actually, Robin, you may have something to say about this, is the opportunities for connecting with healthcare training programs and recruitment programs. And that can include both, you know, schools of public health, not schools of public health, medical schools, medical residency programs, pharmacy schools, nursing schools, and then provider recruitment efforts. And so we wanted to just talk a little bit about some things that we've been doing out here in Franklin County to try to address the urgent need. We have a very, very low percent, how's the way to describe it? The number of people per primary care provider in Franklin County is way, way, way larger than the state average. So we have very few doctors and nurse practitioners. And so we've been really trying to figure out how can we collaborate and be a good partner for organizations that are trying to bring providers in here and train providers and help people understand the beauty of rural Massachusetts. And then so we're going to show you some slides about that, but the other 2 things that we wanted to talk about here on this slide around other ways to create relationships with healthcare in some way. It includes sort of the kind of partnerships we've all probably been part of around responding to some emerging health issue, whether it's EEE or COVID or MPOX or PFAS, you know, anything it could be. There are partnerships there that can be sort of catalyzed by the emerging issue, whatever it is, and then creates a partnership that moves on. I know for me, doing a lot of the work around COVID here, it was the first time that I met regularly with people from healthcare institutions, like all the different primary care providers. And we would have monthly calls about who's doing what. Well, now those relationships are still here, and they've outlasted that particular emergency, and they remain available for, you know, for other partnerships. And then participatory research. Did you want to say something about that one, Jamiah, before we go on to the recruitment stuff?
Sure. So we know that a lot of different institutions have different research studies, and I'm not just talking about, like, you know, a sort of a traditional, we're testing this new vaccine, we're testing this new treatment, but they do provide opportunities for participatory research, community-based participatory research, which is more centered on the broader experience of their patient population. And I think this is a great space to think about how medical schools and healthcare institutions can undo past harms related to research, but also continue to advance their public health goals.
Okay, so one of the things, as I said, that we've been working on in the last 5 years or so is to try to support these regional efforts to recruit providers to come and be exposed to what it is to work in rural places. These don't tend to be easy places to recruit anybody to come to. And so the local hospital system, Bay State, has actually gone all the way to creating a residency program, so that doctors will have to come here to practice, and then maybe they'll fall in love with us. And what I want to say is, even if there isn't a residency program right in your community, there's definitely one somewhere nearby. And medical schools and residency programs are both under a lot of pressure as we understand more and more the importance of the social determinants of health, and the kind of upstream work that we all are doing under this funding opportunity here. They need to think about that too, right? They're under some pressure, and they're from themselves and externally, to connect people to community work, to upstream policy change work. And so they're often looking for partnerships. So one of the fun things we've done is we do an annual bus tour for the new family medicine residents who come to practice here. So they come for 3 years, and on their first couple weeks here, we get one of the public buses, so that they will, probably the only time they're going to be in a public bus. We put them in the public bus and we drive all over the region, and we'll take them to see a rural pharmacy and older adult housing that has no services anywhere nearby, no internet, no public bus. Libraries that have partnerships with public health nurses, immigrant support agencies, some cool places to eat, some cool places to swim. We sort of ask them, what are they interested in? Oh, you want to play pickleball? We'll show you a court. You're interested in kayaking. Here's the right river for it. We always go eat ice cream, and then we always go out to dinner at the end. And it's been wonderful. That's been a really great experience. So the picture on the left here is us meeting with Montague Catholic Social Ministries, Mary and Jimena from there, talking about the needs. And actually, this was great because they were like, "Do any of you speak Spanish?" No? Well, we really wish you did. So they got some feedback about who they needed to recruit next time as residents. And then on the right is a little tiny library in a town of 1,300 people that just won a national award for connecting people to needs, and which gives out fentanyl test strips and Narcan in their bathroom, and has the public health nurse come regularly to meet with people there. So those are 2 stops on the bus. And next slide, please. And this is us. This is the we stopped at an ice cream shop and talked with the medical director of our local House of Correction, Dr. Ruth Potee, and so they got to hear from her about what she thinks the community needs are. And in every stop, we ask the person, the librarian, the whoever, tell us what the needs are in your community from health, and tell us what's great about living here. And so they will also go and do a rotation with her at the House of Corrections as well. And then on the right hand, this guy's a fan favorite every year. He is a pharmacy where he's the only pharmacy for about 200 square miles. And he talks to them about what it means to live in a rural place where it might be days before you can make it to the pharmacy. So not to make assumptions as doctors about what is going to happen when they order a new medication, and also gives them some tips on like the kind of medications that are too expensive for people, or and offers up his phone number for consultation with them. So he's been great as well. Next slide. And just say, sort of, if you were thinking to do something like this, who we invite to come along. So there's obviously the residents themselves. This is this year's crew. And then come along is the CEO of our community health center, the CEO of our area agency on aging, regional public health nurse, and me. So that's the group that's been going. Our Chamber of Commerce has asked if they can come too, so we might bring them next time. And one of the other Oh, good. We're already on this one. Great. Excellent. I wanted to say that there's some other ways that you can interact with folks doing recruitment, retention, and training of medical providers. The UMass Medical has a population, urban, and rural community health program. So this is a medical school that makes sure people rotate through Western Mass. And they are often looking for community-based research projects. We've got a group of them this year working with a local youth substance use prevention coalition to inventory school social media phone restriction policies. So they will often have to do like a community medicine rotation, and you can be that rotation if you sort of get in the queue. And also, again, in terms of their need and desire to connect medical students to real people, um, uh, bringing them to food pantries, senior centers, libraries, things like that. We've also in the past sometimes hosted meetings for the residents as a group to meet the Regional Health Improvement Coalition. So it might be the Opioid Task Force or the Age-Friendly Franklin County group. So sort of try to be a connector for them to health improvement policy work that's happening, because that's such an important part of their training. I've also offered to just meet one-on-one with them, like, how's it going? You know, what are you interested in? How can I connect you to somebody that might meet an interest you have? Because for a lot of them, they've basically had their head down in med school for so long that they don't even really know what's going on, you know, and so they're looking for ways to connect to the community. And finally, I will say, I always give them a pep talk about how important people think doctors are. You know, that I think for them, again, a lot of them, they're young adults, they've been in school forever. They sort of don't necessarily have the sense that they speak with immense authority in the public space. But I try to impress upon them how important it is that they use their societal power for good, you know, and that when I'm doing a lobby day for something, that they come along and they say, hi, I'm Dr. So-and-so, and I also care about spouses being paid as caregivers, or, you know, the safe bill or whatever the bill is, like to help them understand how powerful their role is seen and how important it is for them to use it to increase equity and health improvement. I think that's the end of my show and tell about our
Yeah.
residency week.
No, that's so great. And although I don't have a slide, I did just want to kind of add some like interesting things that we've done here in Boston and really that are sort of similar. I think community tours are amazing ways to talk about the just to talk about the people that you engage with. We have a great one. We have two really important ones here that I've gone on. There's a Chinatown community tour that is led by a really great neighborhood coalition. You get to learn about the history of Chinatown. You get to hear about a lot of their challenges related to housing. They are close to Tufts, and so they've talked about like the good and the bad of that relationship with Tufts. They also to talk about any upcoming policy initiatives that they're working on. And so it's been a neighborhood with a lot of development, but it's also got a very rich history. So it's a great way to bring in sort of both healthcare and community health issues. Also, a little bit of food around on the tour that never hurts. There's also a really great one that Environmentals for Community and Environment does, ACE. They do an environmental tour, and it's a lot around the Greenway along the Orange Line and sort of the history in relation to like transportation and green space, as well as living in like high traffic environments and the impact that that has on the Roxbury community. And it's also another way to talk about particularly like the health impacts of high traffic areas, as well as how they've worked to integrate different community engagement processes into creating the greenway along that the southern corridor. Um, just in general, neighborhood tours are a great way to connect all of the parts of your city to provide like a deeper and a more I guess, relevant and compelling real life like experience. So I just kind of wanted to add that. Another thing that we have done here is that when you do partner, so like let's say you do invite a hospital institution on one of these neighborhood tours or a health center, can you also have a tour of their facilities? Oftentimes, especially in teaching hospitals, they can provide, a sort of assessment of their emergency room, of different specialists that they have. And it's a different way to learn about the different services that that institution provides. You also get to connect directly with the doctors, and if they're doing research, learn more about the research that they're doing. But I think it's a great way to kind of show each other your own spaces and familiarize yourselves with those separate communities. Other ways to engage directly with healthcare institutions is to attend public meetings. A lot of meetings, advisory meetings are actually public meetings, and they are either recorded or in person, and you can participate in that way. I think the health education campaigns and wellness initiatives, similar to what Phoebe was talking about, is a great opportunity for outreach. And again, sort of let's consistently do these types of things, not just come around when there's a problem. But the health education campaigns can be really offer an opportunity for co-development, for learning about communications and engagement, and be a real shared space for learning and development of that campaign. And then, of course, I've already talked about sponsorships, but one community benefit that most institutions do have is different types of sponsorships. So I've seen sponsorships from like $500 or $1,000, and then also larger ones that can be, $10,000, $15,000 that are for like events or particular activities or after school programs, things like that. And so they are interested in engaging in those types of activities. And so we can start to transition now specifically into talking about engaging in your chip. And so I'll just quickly go through this because Phoebe's going to share a little bit more specific levels. But like we already talked a lot about shared goals and just making sure that you guys understand what your targets and primary communities are for the chip. When you are engaging with a hospital, really be sure to review their strategic plan. Their strategic plan, in some organizations, that could be directly connected to the chip, and it may be a separate document. So it's really important to think about what is their long-term goals, and are they thinking about community perspective in those areas? And so that could be an opportunity to provide that. We've talked about data collection and that being collaborative. So again, you don't want to burden community members. So shared patient surveys, shared focus groups that meet both needs. And then with the requirement for the CHNA, that every 3 years that there must be an assessment for hospitals and health centers. So that's an opportunity for ongoing engagement around the data collection component, and it could oftentimes be easier to connect there. And then the chip creation, if a hospital, you can use a hospital chip and add like an engage community perspective or a certain population's perspective on it, or you can engage them in your chip as you develop that. And it's really important to push them to make the changes that are needed so that this can be a truly collaborative and community-centered process.
So I just wanted to share an example. First off, I wanted to say one more thing to what Jamiah was just saying, that we have found it incredibly useful when we can get local hospital data. Generally, all the community health needs assessment data has to come from the hospital to DPH to get all cleaned up and repackaged and sent back out to us. So one major benefit of having a close working relationship with a particular hospital is you can sometimes find someone who will give you some data that's like more recent than 4 years ago, which is great because getting the data from DPH is super hard. So I just wanted to give a quick example of like, how are we working? Oh, I see now. Can you just hit enter a few times? I think there's supposed to be little stars that show.
You
Yeah,
want me to
and
do all the
yeah,
stars?
one more. Yeah.
Okay.
Okay.
Yep.
So, oh, no,
Is
go
it
ahead.
there? There we go.
And one more, I think.
Oh,
Okay.
sorry.
I just wanted to say, so this is our new community health improvement plan, right? This is the end of that, the sort of midway through that circle we saw at the beginning, where we've gathered a bunch of data, we've engaged with the community, we've come up with some priority health issues and priority strategies, and priority populations for those strategies. For our group, we're also using this. This new frame of targeted universalism, which we don't have time to talk about today, but would probably be a great office hours all in and of itself. But basically wanted to say some of what we're working on has absolutely nothing to do with healthcare, but each of these, whether it looks like it or not, is actually requiring some level of partnership with healthcare. And I realize we're going to run out of time. So I'll just say that even things that are about air quality, for instance, are about working in partnership with people who treat people with asthma, or the Age and Dementia Friendly Action Plan is, very much about healthcare and the accessibility of it to the older population and any sort of historically marginalized populations that are, as they get older, are getting sort of double whammied, as well as also living in an extremely rural area with very high patient provider ratios, as mentioned earlier. And some of these things are things we're doing in close partnership with our hospitals. Some of them are with the community health center. Some are with primary care practices like the residency program. But I just wanted to give you an example of sort of how the different priorities might end up working with hospitals. And I'm always happy, in healthcare institutions, I'm always happy to answer questions, but I realize we're going to run out of time. So we can go on to the next slide.
Yeah, so these are like the particular communication strategies, which we've talked about quite a few of them, but I think what's really important is when you're directly engaging with folks, you want to be really clear about your intentions. Is it just to get to know each other? Is it a specific ask? Um, do you want to do you need them to help you with something specifically? So just try to be clear about what the purpose of that partnership is, and then also be mindful of the financial and time constraints, because even though they may want to do this, they may not be able to support you, and so trying to navigate that. And I also just think it's important whenever you make a contact in person or at an event or whatever, to follow up with like an email. Like it could be a one pager about your organization, sharing a newsletter or something, or connecting with them on social media. But it's always good to have some form of follow-up to sustain that connection and be able to keep in contact with the person. So that's all the slides that we have. And yeah, I know we only have a few more minutes, but we'll share these slides after, but would love to hear. Am I sharing still? No. Love to hear any questions or thoughts or additional
Good ideas for
good
collaborating
ideas.
with healthcare also. All right.
Does anyone have anything, like hear anything that they think that would be a great idea to try or adapt into your own community?
I'll just offer that I think UMass Medical also does a residency at the Lawrence Community Health Center, but
Yes, you do.
What about the bus tour thing? Like we had a faculty, I think about this bus tour for me personally, selfishly, about getting faculty more involved and students more involved in the community. And I forgot about the good old bus tour. Like that is really super important for a lot of our faculty don't live in the city of Lowell and some of them do though. Some of them want to settle here. And so I think that's a useful tool for other things as well.
Totally. In fact, I mean, that slide of like who comes on the tour, those people are there a little bit to talk to the residents, but partly they're there because they don't know the county they serve either very well, you know. So they've been very much like, oh, I didn't know it was this rural, you know.
I know I had a faculty member who did a walking tour, which so I think you can only go so far, but I don't know if he does it anymore. I gotta look into that.
Yeah, it's been a lot of fun. And the Regional Transit Authority has been great about just like, sure, we don't have to pay them or anything. They just take us
Oh,
around.
that's even better.
Yeah.
Okay.
Because honestly, you know, it's important also for people to become familiarized with the bus system and think of it as a way to, the thing you can use, you know, out here. I realize we're speaking across such different geographies, but out here the public transit is so limited and goes to so few places that the vast majority of people have to have a car. So getting on a bus for some of them is literally like, you know, wow, I was on a bus today. So
Oh, that is true for most of our faculty here. So
yeah, for sure.
thank you. This was a very interesting presentation and information. I appreciate it.
Well, thanks. And UMass Medical has been great to work with, I have to say. Yeah. Valerie?
Thank you all for,
Oh, Valerie wanted to say
No,
something.
yeah, just wanted to share very quickly. At first, what I had in my head was a relationship that we had with St. Elizabeth's, which is one of those the Steward healthcare sites. So I don't know what our relationship is now, but I do know that we have a number of birthing hospitals where if you've got a good connection, it is absolutely all about those relationships that make referrals right to our Welcome Baby program. They just directly do it or hand off a flyer to a parent and then the parent contacts us. But with St. Elizabeth's, I think we had an extra special relationship at one point, and you know, it may have been with a particular person who was doing a breastfeeding support group and was connected to our Welcome Baby coordinator in Alston Brighton and would just, you know, feed right to us. But then you're talking about the bus tour, and I remember that, I don't know, about 6 months ago, we invited the pediatric department from down the street at the Bowden Street Health Center in Dorchester, from where we live, just into our building to meet our staff and hear about our programs. And we're 2 blocks away from them, and they didn't know everything that we were offering to families and can now, you know, make those referrals, right? Just getting people out of their buildings and their spaces to connect with the community and their partners is so important, and we forget about it. We get caught up in what we're doing.
Right.
Yeah.
So, thank you. It was a very interesting presentation. One thing I want to find out from my colleagues and our director of programs and our executive director, just because I don't know, is how many of them are actually sitting on any kind of, you know, healthcare center board or more have to be a health center than a hospital, but I think it's probably happening, and I just personally don't know it.
Well, thank you.
Yeah,
Thanks,
no, I think that's great. Thank you. Yeah, thank you, Phoebe, for volunteering some time to help with this. This has been a really great conversation, and hopefully you guys got a lot out of it. And yes, walking and bus tours are great. I love them. Not even when they're not related to healthcare. So yeah, everyone enjoy your afternoon, and you can reach out to us. We'll send these slides out with our contact information as well.
Thank you. Bye,
Thank
everyone.
you. Thank you.